breast augmentation, first of all, typically is done in an office-based center, can also be done in the hospital. If it is done in an office-based center, that patient should make sure the office-based center, of course, is accredited, fully licensed. Also, if it is done in an office-based center, the patient should make sure that the surgeon is board certified by the American Board of Plastic Surgery. And those are the first few safety steps that any patient should look into. Now, breast augmentation also is typically done under, at least in our office, we do it under local sedation, which means that patients won't feel, see, or remember anything, but it's not a general anesthetic. It's done in more of a twilight setting. We look at their history. We want to find out if they have had any breast issues, if there's any family history of breast cancer. Now, that's not a contraindication to breast augmentation, but it's worthy of discussion. We do a physical exam. We want to see the size and the shape of their breast, the location on the chest wall, whether there's a droop or not, the measurements, how wide the breast is, how long the breast is, what is the position of the nipple and areola complex. So all of these things come into play. And then we sit down and we have a frank discussion. Like all surgeries, we want to make sure their health is optimized. We want to make sure there's no medical issues, hypertension, blood pressure issues. Depending on their age, we usually obtain a baseline mammogram to fully evaluate the breasts. We review all medications to make sure they're not on any medication that would cause them to bleed. And if they are healthy and their medical history is normal, essentially, and their mammogram is normal, then we go ahead. Most patients are back doing their normal routine within a week and back to exercise within 2 weeks. If we have placed the implant under the chest wall muscle, we custom an exercise program for them because we don't want them to overdo exercises with their pectoralis muscle for 6 weeks, but that doesn't mean they're inactive for 6 weeks.